Happy Friday, everyone. So we are back for the menstrual cycle in the female reproductive system. The menstrual cycle is a 28-day cycle. That begins at puberty with what is known as menarche. This is your first menstruation, and continues obviously monthly until you reach menopause. So menopause is when you no longer have a menstrual cycle because your ovaries stop responding to the hormones that are secreted by the pituitary. Okay? So we're just going to write it on there. This is when the ovaries, so it's not that you're dried out or your ovaries or your eggs go away. Your ovaries no longer respond to the hormones. And so the reason why you can have those people that are in advanced age and still have babies is if they, receive the correct hormones stimulation right to the ovaries, they can sort of continue with the gestation, but they wouldn't be producing their own eggs, but they can still be a surrogate, let's say for a family member or for someone else. Okay, so there are different stages to the menstrual cycle. What we're going to do is we're going to pull up a photo. Oh, don't want that one. That one is from our Pride Week. This is the one we want. Okay. So this is the menstrual cycle, and what I want you to see is that it's 28 days. Okay, so we have this progression of the cycle, and I want you to see that there are events that are happening inside the ovaries and events that are happening to the endometrium or in the uterus. So these are, I'm going to label them as ovarian events. And these are uterine events. So there are things happening in both, and in the middle here we see what the hormones are. So we're going to sort of refer back to that as we're going through the cycle. So the first phase that I'm going to start with is the follicular phase. So the follicular phase starts right after your menstrual flow. So it depends on how many days your menstrual cycle is. As you can see here, they're saying anywhere between 2, 4, 5, 6. This is going to be the flow phase that you see here. And so the follicular phase is actually this right here. So this is the follicular phase, okay? So it's after the menstrual cycle. And in the follicular phase, what's going to happen is FSH is released by the pituitary, and therefore the egg matures and releases estrogen. We know that. And the endometrium thickens. All right, so we have FSH levels are increasing. Here, as you can see, this is the flow, and we have sort of this increase of FSH right here. And as the follicle is maturing, which we can see here, the follicle maturing, you can see that the estrogen levels are increasing. So FSH is going up, and estrogen is also going up. Now, once we reach the peak of estrogen, don't forget that that's a signal to the pituitary to start secreting LH. So look at what happens as we peak in estrogen. The LH levels begin to rise and peak. Okay. Once we get to that, the second phase is known as the ovulatory phase. And the ovulatory phase is right on day 14 of the menstrual cycle. So you can see it right here. This is day 14, and it's called the ovulatory phase because ovulation takes place. So the ovulatory phase, LH levels increase, and we can say that eventually they peak, and the egg is released from the ovary. And then we enter the third phase, which is known as the luteal phase. And so the luteal phase is anywhere between day 15 and 28 of the menstrual cycle. Why is it known as the luteal phase? Once we have released the egg, what we get here is we get something known as the corpus luteum, right? So this is the corpus luteum, the CL. And so once we get into the corpus luteum, we got ourselves the luteal phase. In the luteal phase, we know that the corpus luteum is the one that secretes progesterone. And so you can see that here, progesterone levels were kind of low. And then it's not until we have a corpus luteum present that our progesterone levels also increase, okay? Because of the presence of progesterone in this corpus luteum, we also see that the estrogen levels kind of go up. So these two are going to stay up. Now, we had the endometrium thickening right here because of the estrogen. And now what's going to happen because of progesterone, we're going to see all of these blood vessels are going to form. So our endometrium is going to stay thick because of the estrogen, but it's also going to vascularize. So in the luteal phase, what we have is the corpus luteum, the CL, secretes progesterone, and the endometrium vascularizes. Okay. Then what happens in the menstrual cycle depends on two scenarios. So in scenario 1, what we have is the egg is not fertilized. And in scenario 2, we have the egg is fertilized. So if the egg is not fertilized, then what happens is we enter the fourth phase known as the flow phase. So you're going to get your menstrual flow if the egg is not fertilized. Okay, so this would be the sort of day 1 to ... depending on how long your menstrual flow lasts. Okay. And here, what's going to happen is the corpus luteum disintegrates. And therefore, if the corpus luteum disintegrates, progesterone levels drop. How quickly progesterone levels drop is going to determine if you have menstrual cramps or not. Because one of the things that progesterone level does is when it drops, you start getting these tiny contractions of the uterus that cause the endometrium to be shed. And that's what your menstrual cycle is. It's the shedding of the endometrial lining of the uterus, because if there is no embryo to implant, there is no embryo that needs the endometrium, there is no reason for us to keep a thick vascularized endometrium. We shed it away, as you can see here, it's crumbling away and shedding, and we start with the fresh lining for the next period, the next menstrual cycle, that can increase again and vascularize. And then if we don't use it, again, it gets shed, and then it continues on and on in a cycle. And that's what's called the menstrual cycle. Okay, so it causes that endometrium to be shed, and depending, like I said, on how quickly the progesterone levels drop, your contractions might be stronger or weaker, and if they're strong, that's what we call menstrual cramps. Okay, and the shedding of the endometrium is the menstrual flow. The other development, if the egg is fertilized, the other scenario, then here we're going to have human development. And so for human development, we're going to start with a quick intro for human development. And then we're going to continue it on Monday. So human development is going to sort of continue from there, but let's not forget where we came from. We had an ovum, which was made in an ovary. It had 23 chromosomes. We had an egg. Egg. We already had the egg. We had a sperm, which was made in the testes. 23 chromosomes. These guys are going to come together in a process known as fertilization. Don't forget that fertilization occurs in the fallopian tubes, right? So some of the things that... And what we're going to get is we're going to get a zygote. And a zygote is 46 chromosomes. At this point, you are not pregnant yet, okay? Then, once we get to this stage of development, that zygote is going to proceed through a series of developments. So we're going to start with zygote. And then that zygote is going to be called an embryo. And then the embryo is going to be called a fetus. And it's not until birth that we have baby. Okay? And this whole thing right here, this is known your gestation period. Or your pregnancy, which in humans is 40 weeks, because we count from ovulation, because when the egg is released, that's when sperm fertilizes it. The egg is available for fertilization for only 24 hours, and then it dies off. And so the fertilization window is only a day. And so then we start counting from ovulation all the way up to when the baby should be born, and that should be 40 weeks. And it's actually 10 months, not 9 months. When you go to the doctor, he'll ask you something like, when was the first day of your last period? And so they count from that 40 weeks, okay? And so then this prenatal development is divided into two main periods. Two main time frames. You're going to have the embryonic development. Whoops. And you're going to have your fetal development. The embryonic development is the most crucial time in the development of a baby. It is only about 8 weeks long, this development. But here you're going to have things like differentiation. So this is when the cells sort of get a job they become specialized in both form and function. You're going to have morphogenesis. So different structures start to form. The head, the arms, the legs, those kinds of things start to form quite early. And then you're going to have the fetal development. And in fetal development, really, what we have is we have a whole bunch of growth. And we have sort of the coordination of organs into systems. Okay. So really, the embryonic development, those 8 weeks, everything that is happening during that time, by the time those 8 weeks are up, the baby is only about the size of an aspirin. And so it's all through the fetal development, which is from those 8 weeks on all the way to birth, that we get a bunch of growth that happens, and then all of the organs start to sort of coordinate with one another, the respiratory system, the digestive system, and that's what's going on during that time. Now the next time on Monday, what we're going to look at is embryonic development, and then we'll get into fetal, and eventually we're going to do the birthing process. Okay, so this is it for